So, you open Google Chrome on your phone, you're rushing to buy tickets to a concert that all your friends are going to. Picture yourself now, crowd surfing to the front, being invited onto the stage, backstage the world tour, and before you know it, you're dancing in Tokyo. Wait, what? 3 tickets left? It's a good thing your saved payment details autofill quickly and securely. There's no place like Chrome. Download Google Chrome on your phone.
If you passed Cameron Kellum on the street, you'd see a happy 10-year-old with a smile that lights up the room. You'd never know that this little girl who loves laughing and sleepovers has spent the first years of her life battling to stay alive. Cameron was born with sickle cell disease, an inherited disorder that causes your red blood cells to die.
We discovered that she had sickle cell disease after her newborn screening. She was about 7 years old when she was going for her annual checkup. So she had to do a transcranial Doppler just to see how the blood was flowing to her brain. And it was determined that it was flowing a bit too quickly.
That's April Kellum, Cameron's mom. Cameron had to go in for an MRI so doctors could see exactly what was causing the increased flow. But instead of finding an answer, physicians discovered that Cameron had developed moyamoya disease. It's a rare disorder where the brain's main blood vessels are narrowed. This blockage reduces blood flow to the brain and can cause strokes as well as cognitive and developmental delays or disability.
I was very young. I was a bit scared, but I knew that the doctors were capable of helping me. So I was kind of nervous and kind of not.
Doctors said that Cameron was a candidate for a stem cell transplant that would cure her sickle cell disease and stop the progression of the moyamoya disease. She just needed a match. Kellum and her husband were tested, but neither were a good fit. Fortunately, Cameron's 2 sisters both met the criteria needed to save her life.
So my oldest daughter, Skylar, provided her with the stem cell, life-saving stem cells. And it was such a surreal moment in the hospital. We had one daughter outpatient, that was Skylar, who was doing the donation at that time, and one daughter inpatient, and our other daughter nearby, and they were all on a FaceTime together. It was really an experience that we would never forget, literally watching one daughter save another daughter.
And it was successful. Kellum and Cameron spent 88 days in the hospital, a length of time that is tough on adults, let alone a little girl. Amar Bryant, the lead inpatient social worker at Boston Children's Hospital, says these long-term stays can be extremely difficult for both the kids and their parents.
I'm a social worker, so I can't help myself. But I think that the notion that when folks come to the hospital, there is such a fear and sometimes mistrust, which is our job to alleviate and to make sure that people feel comfortable and heard and acknowledged. I think that that is something that is glossed over a lot, just how families are so stressed and so vulnerable here. And it's our job and privilege to make sure that they really feel like we have you, not only your child, but you as a family unit.
Many of us may not realize all of the challenges that come along with a long-term hospital stay. Aside from these kids having to deal with a serious illness, they become isolated from their social life.
They're at the hospital, they can't see their friends, they're not engaging in their routine and normal activities that they may have, which is, I think, it can threaten their ability to connect with others once they're out of the hospital and once they're a little more healthy, because kids are constantly learning how to engage with their environment. And so when you take a kid and you isolate him, her, or them from their social environment, you're not allowing them to grow as much as they can.
Not to mention the education that many of these kids are missing by being in the hospital. Bryant says a lot of these long-term patients have tutors, but when learning went virtual during the pandemic, it complicated the status quo.
When you have a kid who's in the hospital trying to learn over Zoom while they're also dealing with getting their vitals taken, they're dealing with medications, they're dealing with pain, they're dealing with people coming in and out of their room, it's not a great learning environment. So I think from an educational standpoint, kids lose a lot of their educational skills when they're here long term.
For kids like Cameron, whose lives are confined to a hospital for months, the days can become excruciatingly boring.
So you have rounds in the morning, then you may have physical therapy, occupational therapy, speech, depending on what your needs are. And so you have those treating services in the mid-morning to afternoon. And then afternoon, they typically have rounds so that the medical teams come back and do like an overview of the day and then what to look forward to. And then it's like your nighttime routine and lights out and dinner and things like that. So it can be pretty boring for patients, especially if their pain level is manageable. I think kids can get really bored.
Which is where child life specialists come in. They're healthcare providers who help keep the patient's life as normal as possible in such an abnormal setting. They have training in education, child development, and psychology. Not only do child life specialists help the pediatric patients understand their injury or illness, but they also teach the kids effective coping skills. And more often than not, their job is to help their patients feel like regular kids. Bryant says they're some of the most creative people she's ever worked with.
They will come up with activities and fun ways to keep the kids engaged with their own care, but also allow them to be a kid. So they're constantly coming up with new things, whether that's in a group setting or like on an individual basis. So Child Life is wonderful for that. We have the Ryan Seacrest Studio, and they do a ton of programming. They have bingo, they have guest speakers, they have music, they have dance parties, especially for the kids who are here long term. We try to throw every activity we can.
These events give kids a chance to have fun and forget about their illness for at least a moment in their day.
I think every kid deserves to be celebrated. And I think sometimes that doesn't happen because of circumstance or because of the medical complexity that they have. But I wish that every day we could have something that a kid will have like an awe moment. I think the floors and the nurses especially do fantastic job of making sure that that patient feels celebrated every day with little things that they do that they don't even tell anyone. They just do it because they love it so much.
But Bryant says for patients who are in the hospital for 6 months or a year, even these fun events can feel dull.
It can start to feel like, okay, I've done this activity before. What else can I do? And so the child life specialists are creative. They're incredible. And they work with the patients to come up with own activities that they want. But it's hard because our focus is the medical management of kids. And so we kind of have to balance a lot of different needs.
Which is why child life specialists are so crucial to pediatric patients. Cameron says they were a big part of helping her get through her own hospital stay. Even a gift as simple as a lava lamp to decorate her room made Cameron feel more comfortable and at home.
Cameron really took advantage of all of the services, both in the arts as well as in music therapy. And she was what they called a exemplar patient for Child Life. They helped us with everything. She was 7 years old and had to take about 20 to 30 pills a day and didn't know how to swallow pills. So they helped us manage that process. And like I said, every step of the way, they helped keep her positive and helped keep her moving forward. And they were a large part of why her recovery went the way that it did.
At just 8 years old, Cameron became an ambassador for Maria Ferrari Children's Hospital in New York. The facility is a part of Children's Miracle Network Hospitals, a nonprofit that raises funds for children's hospitals in America and Canada. Marie Osmond, a singer and co-founder of the organization, says they've raised more than $8 billion over the last 40 years.
All these causes, whether it's an accident victim, burn victim, muscle disease, blood disease like cancer, whatever, premature baby, even to a tonsillectomy, all of those causes have to be treated. And that's what children's hospitals do. And so Children's Miracle Network was born, very unique from any other charity in the sense that 100% of the money that's raised stays local, goes to your children, your children's hospital. All of the money goes to the kids.
Since its start in 1983, Children's Miracle Network has grown to support more than 170 hospitals across North America.
They say that over 62 kids enter our children's hospitals every minute. That's a little over a child a second. And coming out of COVID, the mental health right now is a national state of emergency, from anxiety, which is up almost 30%, depression almost up 30%. I know in my area, my daughter went in, she has a little boy that isn't talking, and they said that speech therapy is up 70% now because children wearing masks, they weren't learning how to speak. And so these hospitals, they train your pediatricians, they go into your schools, they teach, they train, they're staples in your community. And I think some of the most powerful institutions we have for our communities, and they're last on government funding, which is absolutely bizarre to me because children are our future.
Nothing says summer fun like grilling outside with help from Whole Foods Market. From family reunions to hanging with friends, you'll find the perfect spread. Like animal welfare certified bone-in ribeye, top sirloin, and chicken kebabs. You can just imagine those perfect grill marks. Keep your wallet happy with sides and fixins from 365 by Whole Foods Market. Plus, beer, pie, fresh produce, the list goes on. Can't take the heat? Let them cater your event. Make summer happen at Whole Foods Market.
And while the donations are extremely helpful, the nonprofits model is special because there's no restrictions on what the hospitals can do with the funding.
The thing that's great about it is it can go into education, it can go into technology, it can go into patient care, it can go into equipment. For example, whether you need neonatal beds. It's crazy what's going on. One of our hospitals literally didn't have an ECMO machine, and they needed it. One of our hospitals needed life flight equipment. And so what we do is we help your community have everything it needs for your community to help your kids. And as a founder, it was absolutely essential because some hospital, I know one of our hospitals got $1 million grant for cancer research, but that isn't what they needed. What they needed were neonatal beds and to help with some of the finances of the people that needed to help with their kids.
Bryant says financial burden is a topic that looms over many families. A 2020 study published in the Journal of Hospital Medicine investigated how common financial distress is for families of hospitalized children. You probably won't be surprised by their findings, which shows that financial difficulties are extremely common. And there are so many factors that can contribute to these issues. For example, one parent might have to stop working to be with their child, or the family might have to hire a nanny to watch their other kids.
So your families are accruing all these expenses that they were not expecting. And the hospital can only help so much, especially when kids are here long term. There are things that you wouldn't even think that will come up for families. So an example is if a family's car breaks down, right? And that is their only mode of transportation to get to and from the hospital. That is another layer of stress and financial impact, because if they are already working in a tight budget, any unexpected thing has a potential to blow things up a little bit. And that also impacts how they're able to be here for their kid if they don't have a working vehicle.
Even basic needs like parking or grocery shopping can become an obstacle when you have a child that's sick. Bryant says these added worries can feel like the weight of the world for families.
So my job as a social worker is to meet with those families and try to alleviate any external stress that I can, because the less stressed a parent can be, the more present they're going to be for their child, which will only make the experience better.
And while this type of extra help may not be what people think about at first, Cameron and Kellum say it's one of the things that got them through their 88 days in the hospital. And now, 3 years after her stem cell transplant, Cameron is considered cured from her sickle cell disease, and the Moya Moya has stopped progressing. Inspired by their experience, Cameron and her sisters have created a nonprofit called Cam's Comfy Corners that donates cozy items to pediatric patients to help them feel at home in their hospital rooms. You can find more information about the Kellums, Marie Osmond, and Amar Bryant on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our executive producer is Amira Saveri. I'm Elizabeth Westfield. Coming up next week on Radio Health Journal.
A music degree holds certainly as much validity as an organic chem or a biochem degree, and we certainly wouldn't put a preference on either of those.
How music and medicine are more connected than you may think.
Then how to advocate for yourself in healthcare.
I joke that women would fire a hairdresser after a single bad haircut. Yet I know too many women, patients, colleagues, who will go to the same doctor even though the relationship is not satisfactory.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I started getting help, like mental help, because I felt supported. Like I felt like, no, I can do this. There are good people in this world.
We dive into some of the data and assistance programs that are helping to break the cycle of poverty. Then,
this year in particular, in a lot of the eastern states in the United States, we saw a lot of that activity much earlier than we typically expect.
The impact of shifting weather patterns. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Trying to grab all the groceries in one trip? Oof, not how you would have done that. You know sometimes less is more. Like when you drive less and save with the USAA annual mileage discount. USAA. Get a quote today.